Texas Biomed is joining forces with 10 institutions in Mexico to find the link between cardiovascular diseases and how our own bodies process food. Dr. Raul Bastarrachea from Texas Biomed joins us on how this study works. Good morning to you.
Good morning. The study is unique. It's a family-based study. We gather in 10 different regions of Mexico, one family each, and we are planning to get 40 individuals related from each region in Mexico.
So this is a very complex study.
Very, very complex because we study the postprandial basis of genetics after a mixed meal, the same meal that we eat every morning at breakfast. So we try to study how our body metabolizes the food that we eat before and after a meal. We take blood, we take biopsies in the leg for fat and muscle. So we are able to study in depth what is happening with your body and who's at risk to earlier develop cardiovascular disease.
So with the meals that are provided to the participants, is there a specific type of food that's given to them?
No, it's what you eat every morning, but carefully calculated towards the measurement of your body composition. For example, if you eat 2,000 calories a day according to your weight and your height, we calculated that you are going to eat 30% of it, which equals a breakfast. And then we let your body dictate what happens to it, because we keep the participants in the hospital for 5 hours taking frequent blood samples, so we know exactly what is the curve on how they manage the food they eat. And that's the key to understand who's the person that is not able to manage easily this very simple food intake, and then these are at highest risk to earlier develop problems, because the food then will accumulate in the blood vessels.
And so the samples that are taken, is it blood? Is it tissue sample? What are they?
We take 10 time points from 15, 30, 60, 90 minutes, 1 hour, 2 hours, 3 hours, and 5 hours. And at the third hour, which is the peak of our digestion after you eat, we take a biopsy in the leg for a plastic surgeon, a registered plastic surgeon, and then we collect a very small amount of fat and subcutaneous fat from the leg, and then a little bit of muscle underneath. It's like a minor surgery, but that for us is gold, because we are able with the new technology to study the genes, the expression of the genes, the messages, what is circulating before and after the meal. And this is very, very nice, because it's what we need to do in order to find out who is at earliest stages to develop type 2 diabetes and cardiovascular disease.
And working with these 10 different institutions in Mexico, really the focus has been on Hispanics, and why is that?
Well, that obviously is because in Mexico we are all Hispanic Latinos, but that was already intended on purpose, because what we wanted to do is to bring in a less expensive environment to do this complicated study that would cost so much here in the United States because of the surgical treatment, the biopsies, and transpolate to our very, very heavy Hispanic community here, because as we are studying genes, all the pool of genes between Hispanics supposedly come from the same background, so therefore it's going to be easily transpolated for both sides in the border when we find out what are the deep insights of this risk for cardiovascular disease.
And there's also links to, obesity. There's also there's a link with the cardiovascular diseases.
Correct.
Yes, right.
The most important fact that we're studying is the risk to type 2 diabetes, the risk to heart attacks, and the risk to cerebrovascular disease. The key 3 diseases that cause 2/3 of death around the world and in the United States.
And when will the study be completed?
It's going to be completed in 3.5 years, we hope. We have already collected and recruited fantastically 125 individuals. We are going up to 400. We have been already given an NIH preliminary grant called R56. So the NIH, the National Institute of Health, has already helped us to do all the processing of the samples that are brought from Mexico here to the Texas Biomedical Research Institute, because we have the advanced technology to do all the sequencing of the genes, all the measurements of the message of the gene, and all the necessary exams that we need to have in order to sort of correlate with all what is circulating in your blood before and after the mixed meal.
Dr. Raul Bastarrachea, thank you so much for being here this morning.
Thank you very much for inviting me, Sharon.
Coming up,